So we are continuing the lesson yoga, and the topic we are discussing that prevention and management of common lifestyle diseases. And we are discussing diabetes. Diabetes, we have discussed that is the when the sugar, blood sugar, is not being tolerated by the body. So type 1, type 2 diabetes we have discussed. Type 1 diabetes, that when the insulin, the hormone who is responsible for glucose tolerance or sugar tolerance in the body and from the blood, that is not being produced by the body. Type 2, when it is being produced but not being consumed by the body, it is not being used properly. So the diabetes that we have discussed, that main hormone, that is insulin, is there, which is produced by the body by the organ pancreas. We have discussed the pancreas that's produced in the beta cells of the pancreas. The beta cells produce insulin. This is very important hormone which is used to tolerate the sugar from the blood and sugar in our body. So because of this insulin, if it is not being produced or not being used by the body, we suffer with the diabetes problem. The person can become diabetic. So prevention of the diabetes we will discuss here. Prevention of the diabetes, first is the regular exercise. Regular exercise can reduce the sugar level in blood. It also improves the production of insulin and strengthens the heart. Regular exercise of 60 minutes per day can prevent and manage type 2 diabetes. Exercise is very helpful in both the cases, type 1 and type 2 diabetes. And regular physical activities should be there. At least 60 minutes per day. This is highly recommended. Regular exercise is highly recommended. It can be in any form. Light physical exercises, walking, running, whatever is possible. So there should be regular physical exercise to prevent from diabetes. Morning walk for the diabetic person is considered very good, very beneficial, which should not be avoided at all. Second, maintain a healthy weight. Maintaining healthy weight is, one should maintain BMI between 18.5 to 25, because the weight can lead another problem. Hence, intake of calories should be monitored according to the consumption of calories, because we cannot avoid it. Avoiding the calories means that is very dangerous, but especially in diabetes, the sugar is avoided, and most of the food items, they contain sugar. So definitely in diabetes it is very difficult condition. Then we cannot survive without carbohydrate, and maximum carbohydrate, it contain the sugar and glucose molecules. Maintain a healthy weight. So healthy weight must be maintained, and intake of calories should be according to the consumption of calories. Calorie means that is carbohydrate. Whatever carbohydrate food we are taking, that should be according to the consumption of energy. So this is clear. Maintain a healthy weight. We must maintain healthy weight. Reduce the intake of saturated fat. Intake of saturated fat in more amount leads to obesity, which in turns make a person diabetes prone. So saturated fat is considered harmful for the body. Avoid rich carbohydrate food, means maximum carbohydrate. We must avoid it. We should take light amount of carbohydrate or the carbohydrate according to the workout. That previous point we have discussed. The carbohydrate intake should be according to the workout, means consumption of energy. The intake of calories should be equal to the consumption of the energy. So carbohydrate rich food should be avoided. Digestive system breaks down carbohydrate into sugar, which is absorbed in the blood, thus raising the blood sugar level can be seen. So in diabetes, we should avoid the condition when the blood sugar is being raised. So definitely we should avoid carbohydrate rich food, or we should take carbohydrate according to the workout. So the next we will see, this is the production of insulin in the pancreas we have discussed. Fifth point is that eat healthy food. Food, whatever we are eating, it should be healthy. Vegetables, fruits, and fibers rich whole grains help in preventing diabetes. More vibrantly colored fruit and vegetables like spinach, carrot, peaches, and berries have more nutrient and help in prevention of diabetes. The colorful fruits and vegetables are more beneficial in prevention of diabetes. Whole grains like oatmeal, barley, brown rice, whole wheat, corn, etc. should be included in the diet. So eating healthy food is another very important. It must have all the variety of vegetables and fruits and whole grains. Another one very important, that is eat a small portion of meal. Always keep hunger under control and take small meals every 2 to 3 hours in a small amount instead of big meals, as it will raise the sugar level high, because when we eat so much, so it increases the sugar level in the blood. And eating in small amount and in small interval of time, after the small interval of time, means 2 hours, after 3 hours, we can divide a meal in the different intervals instead of taking a big meal at a time. So it will also prevent blood sugar level going below normal. So this is about the prevention of diabetes, how we can prevent the diabetes. Now we will see how we can manage the diabetes. Management. If the person is suffering with the diabetes, what he or she should do. It claims to help person who are suffering from high blood sugar level and want to minimize the risk of developing further complications in life. Few lifestyle changes may help in managing the disease. Because this is lifestyle disease, so definitely the lifestyle changes are needed, and the person must change the lifestyle in positively. The diabetes is also known as a silent killer. Once the person is suffering with the diabetes, so it may lead to various serious problems: heart problems, kidney problems. It can damage any organ of the body, any system of the body. So that's why the diabetes is very dangerous. Because the thickness, when the glucose, the sugar level of the blood increases, so that thickness of the blood increase, that is the medium of transportation, so nothing will be transported from one place to another, means different body parts are getting nutrients and the need, whatever they need, it is supplied through the blood, because blood is the medium of transportation. When the blood becomes thick due to the presence of high sugar level, so the blood is unable to move, or either it is moving very slowly, so supply is very slow, transportation of the nutrients and required things is delayed to the organs, which can cause serious problem to the organs and to the cells of the body. So that's why we must manage diabetes very seriously, and few lifestyle changes we must make in our lifestyle. So we are discussing this. First one is eat balanced diet. For type 2 diabetes, patients should consult dietitian for proper diet to keep their blood sugar level within the normal range. Blood sugar level should remain in normal range. So better that is we can consult dietitians, because they are professional consultant about the diet. They can tell about the proper diet, what we should take. Some we have discussed in prevention measure, but in the case of diabetes, when there is sugar level is going to increase in the blood, so definitely the persons are asked to avoid sugar. Now these days the sugar free option is also available. Sugar free pills are there which can give you taste of the sugar, but that is easily tolerated by the body. So eat balanced diet by consultation of the dietitian, and balanced diet means balanced diet. That there should be sufficient amount of protein, carbohydrate, minerals, carbohydrate according to the workout, protein, vitamins, minerals, fiber, sufficient amount should be there according to the need of the individual, because balanced diet says that the proper amount of all the nutrients required to the body. Regular exercise program can improve blood sugar and give improvement in diabetic condition, decrease the risk of heart disease. The exercises should include aerobics and moderate and resistance training. Clear? Aerobics, where sufficient amount of inhalation of the oxygen should be there. Moderate resistance training, that is certain weight trainings. These are recommended, and regular physical exercise is very important for managing the diabetes, that I have discussed in previous slide also, that because especially morning walk is very important. It should not be avoided at any cost for the diabetic person. And regular 60-minute physical exercise minimum should be there for diabetic person. Maintain a healthy weight. We should maintain healthy weight, which will have a positive effect on blood sugar control, that we have discussed. I am not repeating it again. What should be the sugar level? Blood sugar level, this we have discussed in previous video also, that blood sugar level normal is minimum 70 and 100 maximum. This is fasting before taking any meal. If we are taking the blood test, so then the fasting should be not below 70. Then person will suffer with the hypoglycemia. If it is more than 100, so there are chances of being diabetes. And fasting 101 to 125, if the blood sugar level is there, so that is the pre-diabetic condition, means the person is going to suffer with diabetes. Here it can be controlled. But after 125, the person has diabetes, and the person is known as diabetic. So there is serious problem then, 126 above. Fasting, I am telling you, before the meal. Meal, after 2 hours of the meal, if you are going to take the blood test, so normally if it comes 140, it is less than 140, then it is okay. And 140 and 200, it is pre-diabetic condition after the meal, and 200 above is the confirmed diabetes. The person has diabetes. So because after the meal, that I have discussed in previous video also, that most of our food contain carbohydrate. So immediately after meal, when we, or 1 or 2 hours after the meal, when we go for blood tests, so the blood show the sugar, that glucose level is higher always in our blood after meal, and it takes 4 to 5 hours near about to tolerate this sugar from the blood. So after the meal, normally the sugar level is higher, but it not should be more than 140 normally. So if it is more than 140, then there are the chances of diabetes. Slightly the sugar level always higher after the meal. So another step of the management of the diabetes, have a plenty of sleep, rest. 6 to 8 hours sleep will provide required rest to the body and keep the body stress free. And one more thing is there, the stress is always dangerous in case of diabetes. It also leads very serious problems. That's why we need to take sufficient amount of rest to keep our body stress free. Mind and body stress free. It will have positive effect on controlling the blood sugar level. Clear? So have plenty of sleep, 6 to 8 hours sleep a day. Manage stress, that I was telling in previous point. Stress is another very serious problem. Stress is one of the reason for disorder of blood sugar level. Stress should be managed because the stress leads increased blood sugar level always. Asanas and pranayams help in keeping the body stress free. So always the person have to keep themselves stress free to manage the diabetes. So manage your stress first in case of diabetes. People must remain happy always and always keep your mind relaxed and cool, and take rest psychologically also, and take help of asanas and pranayam for keeping body stress free, body and mind stress free. This is psychological stress I am talking about. Body stress we have to keep away, but psychological stress also we have to keep away to manage the diabetes. Take regular medicine. Whatever the medicines are recommended or prescribed by the doctor, medicine should be taken regularly according to the advice of the doctor. Type 2 diabetes can be tackled by healthy diet and regular exercise in initial stage. In advanced stage, regular medicine is required in the form of tablets and insulin injections. Whatever the person has been recommended to take the medicines, they should take it regularly on time, and that can help to manage the diabetes. So this is about the diabetes. We will come to the hypertension now. Hypertension is another lifestyle disease. So hypertension is known as high blood pressure. It is known as high blood pressure. What is hypertension? It means increased blood pressure. It has two components, systolic and diastolic blood pressure. Systolic blood pressure and diastolic blood pressure. One is the lower blood pressure and another is the higher blood pressure. Systolic is the higher blood pressure, diastolic is the lower blood pressure. It is measured in millimeter of mercury, that is mm per Hg, that is the unit to measure the blood pressure. The higher blood pressure should not exceed more than 120, and lower blood pressure should not exceed more than 80. So that is the condition considered high blood pressure if it is more than this. So 120/180, 120 higher blood pressure systolic and 80 is diastolic blood pressure, considered normal blood pressure of an adult person. And below this also, if the blood pressure is there, so that is considered low blood pressure. So below 70 and the lower blood pressure, and below 100, that is considered low blood pressure. Earlier, hypertension was considered middle and old age problem, but nowadays the youngsters are also facing hypertension due to not practicing positive lifestyle. Lifestyle diseases, definitely this is the reason is the poor lifestyle. So the people does not have proper lifestyle, positive lifestyle, that's why they are suffering with the hypertension also. In case of hypertension, the person remains aggressive all the time because due to the high blood pressure always remains high. Causes of hypertension, see here, obesity, that I have discussed in previous video, in which obesity we have discussed that obesity is the doorstep of many lifestyle diseases. So hypertension is also caused due to obesity. Inactivity, the person is not active. Alcohol, it may be genetic, hypertension may be genetic also, hereditary. Smoking, low potassium and calcium and magnesium. So potassium, calcium and magnesium is low in diet, they may suffer with the hypertension. Stress, the psychological stress, that also leads to hypertension. Salt, taking higher amount of salt, that also leads to the hypertension. These are various causes which are responsible for hypertension. Uncontrolled hypertension causes premature death. Uncontrolled hypertension causes premature death. It increases the risk of heart attack. It increases the risk of stroke, kidney failure, blindness and other complications. So hypertension can lead to heart attack, stroke, kidney failure, blindness and other complications in the body. So this is another very serious, dangerous lifestyle diseases. Prevention and management of hypertension. Hypertension usually cannot be cured but can be prevented as well as managed if one follow the below mentioned points. It is difficult to cure. Usually it is very difficult to cure, but it can be prevented and managed. Under control, we can keep it under control. So the points are, first one is change in lifestyle. Change in lifestyle can be a boon to the person having hypertension. One should take a balanced diet. One should lead active and healthy lifestyle, and sedentary lifestyle should be avoided as it leads to depression. Alcohol, smoking and other stimulants should be avoided. So change in lifestyle should be all the positive habits we should opt, and all the habits which are favorable to the health, which are good for our health, should be opted, and all the bad habits should be avoided. Those habits which are not beneficial, not favorable for the health, should be avoided. So that's why that is positive lifestyle we should opt. Second, exercise or sports activity. Sports activities are helpful in prevention and treatment of hypertension. Moderate exercise with high intensity are very effective for a long-term blood pressure lowering program. The exercises should be performed regularly for good result, because exercise always give good results when they are performed regularly. Once upon a time, then if you are performing any exercise, so that is rarely give any benefit. But if you are performing exercise regularly, that will give us, surely it will give us benefit. So mostly the sports activities are considered very good. Exercises with high intensity are very effective, and the intensity of exercise during the high blood pressure should be also selected properly, because they also increase the heartbeats, which can lead a problem. Because already the blood pressure is higher. During physical activity and higher intensity activity, the blood pressure also increases. Reduce obesity. Reducing body weight is the most effective way to prevent and manage hypertension. To achieve this, one should go for balanced diet and quality program of exercises under guidance of an expert. So obesity should be reduced at all by following the instructions to reduce the obesity. Another one, fourth, is take proper diet. Reduce intake of sodium, that is salt, sodium chloride, NaCl, with that salt we take. So sodium is reduced in diet, especially the salt contain it. Take food containing potassium, calcium, magnesium, high fiber, whole grains, vegetable, etc. Researchers indicate that such diet is beneficial for hypertension. What we have to avoid? Sodium or less amount of salt in food, and take food containing potassium, calcium, magnesium, high fiber, whole grains and vegetables. This will be beneficial. Relieve stress. Stress should be relieved, because stress can lead again problem here, because relieving from stress reduce hypertension. One should try to indulge in recreational activities as well as in meditation, regular walk, mixing with community. Means when we live with people, so we remain happy, the mind is converted, so we will feel relaxed in the stress. We will have very less stress when we are involving ourselves in recreational activity, in entertaining activities. That time also that reduce the stress. So stress should be relieved. Take medicines if measured, if measures like changes of the lifestyle, exercise and diet are not able to prevent hypertension. So 140 to 90, the high blood pressure, and more than this it is, or more than this, because 120 is normal, 120/80 is normal, so it is higher. One requires regular medication. These medicines do not cure hypertension but only controls within normal limit, and one has to take these medicines for the lifetime. And the medicines, according to the prescription of the doctor, according to the consultation of the doctor, the medicine should be taken regularly, whatever the doctor has advised. Do not take any medicine yourself, because that may lead any serious problem. Consequently, it can be said that by following the above mentioned point on regular basis, hypertension can be prevented and managed effectively. So this is all about the hypertension. We will come with the another lifestyle disease, that is back pain, in the next video.